Hi, it's Dustin Lanier. Thanks for listening. Please find me on LinkedIn for original public sector operations content every week. And please reach out to me if I and my team of procurement professionals at Civic Initiatives can help you be a public procurement change agent. Today, we're kicking off a new thing called Change Agent Chats, where I'm able to talk with people about things that are happening in the space. These are intended to be kind of quick and informal. So we're going to go ahead and start. So Rob and Andrea, I met both of you guys during COVID, and Rob, you and I have talked a couple of times. So why don't you guys introduce yourselves, Rob, then Andrea?
Hi, I'm Rob Handfield. I'm a professor of supply chain management at North Carolina State University in the Poole College of Management. And I was involved in the Joint Acquisition Task Force during COVID, helping to identify sources of PPE and supplies, and also worked with Andrea on a project that involved interviews with all of the state chief procurement officers that was facilitated by NASPO, the National Association of State Procurement Officers. So we both had front row seats and some really interesting, compelling discussions with state government officials responsible for the statewide response to COVID during that timeframe.
Andrea, why don't you introduce, and then after you introduce, give a high-level follow-up on an introduction to this paper.
Yeah, sure. So my name is Andrea Patrucco. So I'm a faculty, I'm assistant professor of supply chain management at Florida International University College of Business. So my research area is public procurement. As Rob was saying, we collaborated on this project with the National Association of State Procurement Officer regarding state response to the COVID pandemic and PPE acquisition strategies and the relationship with the Strategic National Stockpile. Personally, I also collaborate with the NIGP as well, the Institute of Public Procurement here in the United States. And I am part of the European Union Public Procurement Expert Task Force. So it was nice to have like a comparison of what was going on here in the United States compared to what was going on in different countries also in Europe. And we're particularly right now focused on a big topic that followed the COVID procurement emergency, which is like the need to share data and guarantee transparency in public procurement. So I think that there's a lot to be done in this area. Regarding the paper, so the idea of the paper is that, as we all know, the COVID emergency exposed issue regarding the distribution and availability of critical goods, but particularly personal protective equipment at the federal level, but also especially at the state level. So we realized that there were a lot of efforts by the federal government to try to allocate and distribute PPE using various data sources, and different type of resources. But despite that, what we saw is that like several states, local government and other agency, hospital, they were still in shortage. So healthcare facilities were in danger of providing patient care during that period, which raises the question of why was that federal strategy for PPE distribution ineffective? So analyzing why, what were the reasons why the federal government was not able to effectively support state, local, and health institutions during COVID? And second, what type of reform are necessary to enhance preparedness for future disasters? So what lesson learned can we take from COVID to increase preparedness in the future? And to do that, we particularly focus on a strategic resource in the United States, which is the Strategic National Stockpile. So we analyzed through interviews with state procurement officials and also members of the Emergency Task Force of the United States government, what happened and how can the management of the Strategic National Stockpile can be improved in the future to avoid the same type of shortages and be more prepared to future supply chain crises, which again, we hope that they will not occur, but in the eventuality that they will occur, we need to ensure better resiliency.
So Rob, maybe just to quickly continue sort of the timing of this paper, and then we'll get into some questions. Some of these things were known anecdotally towards the end of COVID. How is this paper new, or how is it added to the conversation of what people sort of understood anecdotally? Like, what have you guys captured that extended the knowledge in the moment?
Well, I think the contribution is there's always been sort of some confusion or misunderstanding regarding the role of the federal government relative to the role of the state for these kinds of major disasters. So FEMA is the largest emergency management association, and they define an emergency as any kind of incident that results in extraordinary levels of mass casualties, damage, or disruption. And emergencies can occur very quickly or over time. And if an emergency exceeds the local government's response capacity, in other words, the local city or the local county, then it becomes a state level intervention. If it exceeds the level of the state, then it and starts crossing state boundaries, then it becomes a national issue. Mm-hmm. And at that point, that's when the federal government gets involved. And in the U.S., disaster management is generally classified into mitigation, preparedness, response, and recovery. And so the entity that therefore is responsible for disaster management when something happens across the country is the federal government. Unfortunately, there often is a disconnect in communication between the federal, the state, and the local actions. And here again, in the case of COVID, this was the major source of disaster, and it was a complete failure in terms of the inability of the state and the federal government to work together. Mm-hmm. And this became evident when we started interviewing chief procurement officers, is we asked them, what has the federal government been able to do in this case to help you with this? And we found that they were, first of all, they were dramatically unprepared. The role of the Strategic National Stockpile was, and the SNS has only been around for 15 years or so. And, their role has always been sort of as a disaster management response to things like anthrax or, these other kinds of things. They were not prepared in any sense for anything like the pandemic. And it was founded during the Clinton administration. And, very often they're responsible for, pharmaceutical interventions like antidotes and antitoxins, ventilators, that kind of stuff. And what we discovered, of course, was that they were completely unprepared. Most of their stock of masks, N95 masks, had not been renewed since 2009, which was the H1N1 disaster, and were completely outdated and expired. The elastic bands would snap if you try to put them on. And so we asked the states and the CPOs, what was the role of the federal government in your response? How effective were they? And we also looked at some interesting data to show what was the allocation of existing supplies across the different states? Was it done based on per capita, based on, the number of deaths, based on the number of nursing homes, the number of at-risk adults? And we found that it was there was really no discernible pattern in the way that those supplies were allocated to states, which means it was pretty much a random process. There probably wasn't a process. Andrea, maybe you want to add to that as well.
Yeah, so I think that the lack of timely and reliable data, I think, was one of the main issues. The federal government faced several difficulties in putting together valid, reliable, and timely data regarding both domestic supply chain and states' need. And clearly, that should have fed the distribution strategy. But as this data was not available, of course, that affected the pattern behind the distribution. I think that Rob said pretty well, like the most surprising thing was that we were not able, like our analysis is inconclusive. Like we couldn't find any type of pattern in the characterization of the distribution strategy, which is exactly what it shouldn't happen during an emergency of this type. More than that, what we also found is that there was kind of like inadequate coordination and communication between federal agencies. So between FEMA and the Department of Health and Human Services and also Department of Defense. So we heard from states that sometimes they were receiving inventory of PPE from different sources and other states that instead didn't receive it at all. So it gives us the feeling that within the federal government, due to the magnitude and impact of this type of emergency, there were not coordination and communication of what was done within the federal government, which also clearly prevent an effective support to federal, state, and local entities, which has the consequence that when the states felt like the same, like that there was not a clear distribution and allocation strategy, clearly they then start organizing the purchasing of PPE on their own, creating even more confusion in the system, because clearly then they were going to compete within each other, but also with the federal government that at the same time was trying to procure the same type of goods and services. So it was kind of like a snowball events type, like as the federal government didn't have an effective distribution strategies, which had a negative effect on the need for state, on the support needs for state and local government, then the reaction from state especially was to try to organize themselves, their purchasing of these critical goods, which create even more confusion in the distribution strategy of the federal government. So there was kind of like a vicious cycle.
A few stories that I'm remembering from this time frame, because I deal with a lot of procurement officers and dealt with them then. I don't think that procurement officers, that this was a standard thing that they were expected to have contracts for, or to have an understanding that they were supposed to have stockpile on it, because a lot of times these kind of purchases would have been considered more in the health and human realm. And so, I talked to one procurement officer who at one point said, "Do you know how many pallets a million surgical gloves comes on?" And I said, "No." And they said, "Well, neither did we." And the answer is 135. And so now you have people buying huge quantities of supplies that then now it's not just the acquisition, it's the storing and it's the logistical organization of it. And then I had a different CPO say that they had to organize the inbound flight of a certain set of PPE so that it wouldn't be taken by the federal counterparts to intercept the purchase of this for the distribution process. So it was definitely the wild, wild west out there in terms of a new area to acquire, lots of people feeling a lot of pressure that they had to do things at the same time, and very limited coordination. And in fact, sometimes the states and the feds would be competing with each other. So what did you find as far as the effect of that on things like supply hoarding and not willingness to share? And then suddenly now we have a bunch of these things and we don't know what to do with them. So how did this process lead to sort of unequal capture and supply of the stockpiles at an individual level?
Yeah. During the interviews, we heard a variety of different stories regarding what did and didn't happen. And, some people, said, initially we did get some supply, but we didn't get enough that we were hoping to be able to get. Some said we did receive products from FEMA, but, the vibe we had on it is we were never too sure what was coming or when it was coming. So it was a complete communication breakdown in terms of really effectively managing what products were available. And when I interviewed part of the folks at the SNS, and we wrote about it in a Harvard Business Review article, they said, "Look, we had no idea," and this was incredible. They did not have people who were acquisition professionals working in the national stockpile. They basically had clerks. And, this guy said, we had no idea all this product came from China. And the first indications we got were that the big distributors that we rely on, the Cardinals and McKesson said everything had been frozen. So, they were completely, starved of resources. Their budgets were have been cut repeatedly. They don't have acquisition professionals working in there. And as Andrea said, they don't have data. They don't have access to information to even understand where to send products when and if they receive them. And, their response has been to start hoarding a lot of PPEs, since COVID occurred, and to keep, a year's worth of supply in these big leased warehouses, which, I'm not sure that's a long-term strategy either that is worthwhile. I think what we need is we need a national recovery strategy, and we need some public policy, that dictates the types of governance that needs to occur within the SNS, but also across all of these other agencies. So there needs to be, proper funding of the national stockpile. Today, or prior to COVID, it was sort of a small office under the ASPR, the director of the pandemic response. And the ASPR was generally a clinical person, again, who didn't understand how supply chains operate. So, we really need, in the end, some supply chain expertise at that level to be able to deal with these kinds of things. And it simply wasn't there. There was no data. There was no organized method of being able to do that. Part of what we also have is in our paper is we come up with a number of specific recommendations based on our findings that we think can help overcome some of the inherent, design flaws of the current national stockpile.
Andrea, why don't you pick up there?
Yes, and the one huge recommendation is strictly connected to what you just said and what Rob already explained. So one of the biggest issue moving forward is an improvement of emergency supply chain governance. States organize themselves, and of course, competence are different across states. So we have states in the United States that are more used to deal with emergency situation because they deal with the smaller scale disasters. So they know exactly, or they know more or less how to procure goods that are in shortage. So they have developed some strategies, they have warehouses, they have inventory policies in place that they can be dynamically changed. Well, there are other states that was the first time that they have to face a situation like that. So clearly these states were not prepared, and these lead to the situation you just described. People didn't know how much to purchase, how much to stock, how to stock, if they have to invest in a warehouse or not. So this is due to the fact that everything was kind of like improvised last minute. So improvement of the supply chain governance, so a clearly outline of the emergency plan in situation like this must be the priority moving forward. Clearly, these need to be paired with the fact that supply chain competence and topics and models and tools need to be incorporated in states' official. The other important thing that we found that several states do is the support. There was something that was unique, and maybe then Rob can expand a little.
Rob, when we were early in COVID, I wrote an article that said, this is not a hurricane. And my premise of that article was that when we think of disasters, we think of something that is generally, geographically constrained, and it comes and it's awful, and then it goes, and then we get into a long period of recovery. So that tends to be the patterns of fires and hurricanes and plane crashes and all kinds of awful things we could sit here and list. The difference of COVID was it was happening everywhere at the same time. And, Andrea had mentioned some places are more used to dealing with disasters than others. And it was happening at the same time, and it wasn't passing. So it was continuing to be in the middle. So it was very different structurally than other disasters that we maybe had dealt with or had been built for. So what does the report say as far as trying to build some of these competencies or this support infrastructure from the feds if that kind of thing comes back again? Like, how do we not just be dependent on the fact that Florida and Texas and Louisiana are used to dealing with hurricanes, but Des Moines, Iowa is not?
Right. Well, and you bring up a great point. And, it also starts to get into, some of the constitutional issues, because the state's first responsibility is for the public health of their citizens, which does not preclude a role for the federal government, especially when you have, these national, in this case, international crisis, which isn't limited in terms of time and of geography. It was something that impacted everyone. So we came up essentially with four recommendations that we think are really important. The first is, the federal government is not an expert in logistics, and neither is the state. And so, we thought, well, the private sector is really good at distribution. And so we did see some states like California where they relied heavily on, like, UPS in this case, to lease a warehouse and to help them with their distribution. And this is not unlike what happened, believe it or not, in World War II. The federal government enlisted experts, they call them $1 a year men, from some of the largest companies in the US, like Ford and GM, who had practical knowledge of production and supply chains and could figure out how to best organize, these kinds of initiatives. So we really think it's important to have that kind of expertise and being able to really bring those folks in, especially when you have a disaster of this scale, and not try to, just do it through, government bureaucrats and clinicians that understand federal policy but don't understand, how supply chains work. The second type of reform is we really feel there's some kind of a centralized approach to procurement that needs to be coordinated through a central production board. And again, this also occurred during World War II. The U.S. established the War Production Board, which was a new administrative agency with full power for mobilizing industrial resources. And again, we think that this is something that should and could be done to be able to mobilize those resources quickly, to bring together multiple agencies because they all play a role. There's no specific exact format for that government, but we need to bring together, DHHS, FEMA, the FDA. There's ASPR. There's multiple agencies that need to be involved, and I think a special type of board would be required in this case. The other piece is, we really need to make a pandemic response a strong, centralized political issue. There really wasn't, a lot of political visibility and support prior to COVID. It was almost an afterthought. And, there was something called the FEMKE, which was a national plan for a pandemic response. If that had been followed, we probably would have been okay. But, it was sort of lost in the shuffle. And so we need to have strong political support for this supply chain response. And then finally, the federalist government structure defines the roles and responsibilities of the federal government. And we were sort of in uncharted territory. How do you design a governance system that combines centralized government coordination with decentralized and distributed state decision-making? And so there were a lot of tensions between, the states that expected to receive substantial federal support and the federal government's inability to meet those expectations. So we really need to have a stronger mechanism for federal and state government during this kind of a disaster response. And part of that also requires we have better data. We have to be able to, create a data collection system to understand what's going on. Just as an example, we worked with SAS, and SAS worked with the German government. And the German government has a single healthcare institute that manages the entire healthcare facilities for all of the country. They mandated that every hospital in every part of the country had to include specific data on the number of cases, the conditions of those cases, and how much inventory they had. And they had to do that on a daily basis. And, that allowed them to create a dashboard and to be able to monitor and allocate materials as required. And, unless you can have that mandate to share data and provide information and a means of collecting that data, you're flying blind. You really don't know what to do.
Andrea, have you guys been able to take this kind of information outside of this report? How are you promoting this report, and how are you trying to make this be part of a conversation?
Oh, that's a good question. And I just want to add one small
Please.
but important point, which is connected to your question. A key point that emerged through the interviews when discussing what can be done better next. There was a lot of discussion regarding the need of supply chain competence and governance and the misalignment. During COVID, there was a highly underused and under-exploitation of group purchasing. Unfortunately, that was not planned during COVID, so there was a delay in reaction from, for example, NASP value point to support the state. But when they find their way to bundle contract support the state, the situation was much more improved. So we're in contact and in touch with procurement organization and group purchasing association to try to get the conversation going and clearly do some bottom up pushing because clearly this can only move is from a central government perspective. There are investment into this. So I think that if the demand comes directly from the states and from this organization, then these recommendations are written in the report can then become more actionable.
Okay. I think we've introduced people to the report. It's out there if they want to go and find it for themselves. And then maybe just give us some final thoughts on, for the parts of this that aren't state coordination, but federal coordination, how are we? I'm sure a lot of people are still exhausted and PTSDing from having to deal with so much COVID. So how do you get them to think forward to, we may have to talk about this again, maybe not for this kind of thing, but for something else? How do you get the federal people to be willing to listen and think forward and listen to some of these lessons on something we might build towards the future?
Well, the thing I want to emphasize is, COVID is not over. Unfortunately, people like to think, oh, it's over, it's behind us, it's never going to happen again. It's still out there. I knew several people who had COVID cases in the last couple of weeks. And anytime you have, COVID strains that are running around, you're going to get variants. And when you get variants, if some of those variants come back and they're dire, they're powerful, we could have another episode of this. The economic impact of COVID was just tremendous. It really destroyed a lot of people's lives. The health impacts, so many people died as a result of it. It was absolutely devastating. And I think people are, maybe saying, well, we don't want to, we want to put that in our past. We want to put it in our rearview mirror. We don't want to think about it. But we absolutely need to think about it. It was interesting. In 2010, I wrote a report for the IBM Business of Government that said, preparing for the inevitable, how to get ready for the next pandemic. And I joke because, copies of that report are collecting dust in my office. No one ever read them. No one got prepared. And I think it could happen again. It very well could happen again. It's not a zero probability event. And so I think at the state level, we spoke to a lot of states that are now recognizing, the important role that procurement plays at a state level. And I think some states are really ramping up their preparedness and thinking more about that, recognizing that they can't just depend on the federal government. At the federal government, there's been a lot of talk about reform. I haven't really seen it yet, to be honest. There's been a lot of committees and a lot of discussions. I don't think there's been enough action yet along those lines. I hope to be proven wrong, but I don't think we want to, let the dust settle on this and not learn from it.
Well, great. Well, you guys have been great to help kickstart some of the use of this tool. I had dinner with Sarah Scudder a couple of weeks ago, and she was telling me she's using this tool all the time. I was like, I have this. I should be using this. So we're going to try to start using this tool to do these kind of quick conversations, see who wants to actually listen on LinkedIn, and then put it on the podcast. I appreciate you guys being willing to jump on and help me knock the rust off of this thing and talk about a super important topic.
Thank you so much for hosting us.
Yeah, thanks, Dustin. Pleasure to be here.